Welcome to another episode of How to Pass Your NCLEX. Hi there. We're going to be talking about neonatal jaundice, and boy, we have so much to unpack on this subject. Hello, everyone. If it's your first time joining me, my name is Professor Regina, the #1 NCLEX instructor on the planet. And just as I was settling into having that title, #1 NCLEX instructor on the planet, something major happened, and I'm going to be talking about it. I hope you will join me at this event that I'm throwing. It is everybody here? Okay, we're all here. Kenya in the house. I see you, Kenya. I see you. But anyways, I'm having this event that I'm inviting you to. I want you to be there, especially if you are in nursing school. I'm calling it Back to School Nursing 101. And this is huge. This is major. We're going to be talking about how to position yourself for nursing school, to have the mindset you need to have, an orientation to it, and of course, the content. So this event is going to be for my nursing school remarks who are still going through the grind. I'm going to be releasing my new course to help you get through nursing school. And it's phenomenal. You guys have not seen anything like it. If your school is using ATI, this girl's course right here is going to help you get those proficiency levels that you must achieve, even if you don't read the book. Like, that's how good it's going to be. Even if you don't look at the ATI products at all, you're going to be able to take the exams and you're going to be able to do extremely well because of the curriculum that I'm putting together for my nursing students. So this particular event is going to happen this month, back to school. We're talking about back to school, August the 26th at 8 p.m. Eastern Standard Time. So if you're a nursing student, welcome to the real deal. Okay. Welcome to the real deal. So I'm really, really excited about that. And I understand when you guys are doing the NCLEX V2, some of you are like, man, I wish I had this in nursing school. And this is nursing school. Okay. This is one of the nursing school books. So I am like, I got to help you guys to understand this. This is one of the books and I use these books to create the course. This is the other one. Focus on pharmacology. I said we had a work to do to make these topics digestible for you to be successful. So don't fear. Help is here. Back to school event. You can sign up for it by going to remarnurse.com/back to school, and you'll be able to sign up for it. Of course, this is an event, so I'm be putting out a workbook. We're going to be talking about all the good stuff. So if your school uses ATI or even HESI, you will do well to have this course. And I think I'm going to have it launched for you guys at that time. I honestly don't want to have a whole bunch of people on it. I want to run a pilot group. And so I may say, hey, the course is open on this day, jump in and then close it off after that. And that's just because I want to make sure that it is well tested. So I'll be doing that. Also, I haven't even told anybody this yet, but we also are going to have, y'all going to be so excited. And trust me, I'm getting to the topic as well. Oh, but let me say this. This book right here, Quick Facts for Nursing School, that will be a part of the course, is available on Amazon. So you guys can get this on Amazon right now too. I know you like the fast shipping, but anyways, yes, 1-day shipping on Amazon for the Quick Facts for Nursing School. Another thing is the teas. My teas course will be coming out as well this month. So those of you who are needing to take the teas to get into your nursing school or get into from that LPN to RN program, and you wanted me to do videos for teas, the math, the science, the English, the reading, yes, doing them. So happy to be doing them for you as well. Everything is going to be perfect for this year. So I will let you guys know as well when that drops. Look for it in September. Okay. So don't email like, hey, I need teas. It's not ready yet, but I think September, it'll be ready for you guys. So let's just plan to get ourselves mentally prepared to jump back into our nursing school, our curriculum. It's that time again. It's that time again. All right. So we are talking about, happy birthday, Moon. We're talking about this subject today, neonatal jaundice. And it is coming from Quick Facts. Where did my Quick Facts book go? So if we open up Quick Facts and you turn to page, come on in. If you turn to page, it's under actually hyperbilirubemia. If we turn to page 40, are you guys with me there? Because we're going to be working out of this book. Everybody should be in their Quick Facts right now. We're going to be talking about neonatal jaundice. When I went to do this subject, look how much just for this one. Okay. So we have a lot to discuss here. Your book should look like this. Everybody's Quick Facts. You should not be able to give this book to anybody once you're done with it because it should be a wreck. Okay. So let's talk about neonatal jaundice. Everyone, come on in. When we are discussing neonatal jaundice, it's also known as hyperbilirubemia. And that is what I put in the Quick Facts book. So this is a disorder on the surface that causes the infant's skin to appear yellow the first few days of life. Now, we understand jaundice because we know if patients have liver disease, they will become jaundice as a pathological sign. But why do we care about hyperbilirubemia in newborns? What is the big deal about it? That's the question you should be asking yourself. Why does it matter? Why is it going to be on NCLEX? So if you have Quick Facts, what I wanted you to get out of this is that this is a condition that can be considered common, and then it can be considered an emergency. So this is why I have it in Quick Facts. And we have to know the distinction between when is this just, oh, this is normal, okay? Or when is this just, okay, this is in a medical emergency. So when we're talking about hyperbilirubemia, we are talking about an increased what? What is the thing, okay? The thing is bilirubin. I'm on page 40. So when we are talking about bilirubin, we should always understand that number one, bilirubin is considered a poison. It is not considered something that we just want to have floating around in the body. Whenever bilirubin is floating around in the body, it should be binded to something like albumin so that it can be carried away. Okay. So bilirubin, let's just set a foundation for it. I mean, we haven't talked about this in some time. Where does bilirubin come from? Where does bilirubin come from? And this is the beauty of content. This is why we can't just do questions, because we have to first understand what we're talking about. So bilirubin comes from the breakdown of red blood cells. And when this happens, then we are usually in nursing class and we're learning about it and we're like, okay, bilirubin comes from the breakdown of red blood cells, but now what? Okay, now this is where teachers start getting fancy and they start talking about unconjugated and conjugated bilirubin. And this is where we usually get lost. So bilirubin comes from the breakdown of red blood cells. When this happens, it's called indirect or unconjugated bilirubin. The reason why it's unconjugated is because it hasn't reached the liver yet. And the liver is where it gets conjugated. So the breakdown of red blood cells creates this bilirubin. This bilirubin is floating around now where? If it's coming from the red blood cells being broken down, it is floating around in the blood, okay? So we are talking from page 40, hyperbilirubemia, okay? This is what shows up as neonatal jaundice, all right? So we're talking about the bilirubin, okay? Yes, so when it's broken down, it's floating around in the bloodstream. Now, for a newborn baby, do we want bilirubin floating around in the bloodstream when it is unconjugated or indirect? Unconjugated, indirect means the same thing. It just means that it's been broken down. All right. and it's floating around in the blood. It hasn't reached the liver yet. Why don't we want that floating around? Because indirect or unconjugated bilirubin, watch this, indirect or unconjugated bilirubin can cross the blood-brain barrier. Yes, it is fat soluble. So that means that in a newborn, it can cross the blood-brain barrier. And what happens when bilirubin crosses the blood-brain barrier? What happens to it? Okay. The baby can have brain damage. So this is why this is so important. Okay. The baby can have brain damage. Now, does anyone by any chance know what do we call the brain damage that happens from bilirubin? Anybody know what it is? And I hope y'all don't mind this content review, because I know some of you like to study with just doing practice questions and you like to just come on here and do practice questions, but I will never teach that way. Okay, good job. So what we call that bilirubin brain damage, we call that kernicterus. Okay. And kernicterus is really a terrible thing because it will have hearing loss in the baby. The baby will be cognitively declining. The baby will have abnormal eye movements where they can't move their eyes. So they're always kind of like looking like this because their eyes won't move. This is kernicterus. We don't want the baby to ever have this. But this is what happens if you have that unconjugated bilirubin floating around in the bloodstream and that level goes up. All right. So this is what I wanted you to ascertain from the quick facts portion of this. Another thing that I have here, I talked about bilirubin being a poison. So what I wanted to say about this too in newborns is that when that bilirubin is released in the bloodstream, what organ did I say is supposed to take care of it? What organ? Do you remember? Okay. The organ that was supposed to take care of that unconjugated bilirubin is the liver. The liver. So that baby's liver is supposed to help clear out the bilirubin. Okay. And that baby's liver is supposed to say, okay, let's take this unconjugated bilirubin and let's conjugate it. Yes, that's what that liver does. So whenever the bilirubin has went through the liver, then it becomes conjugated. All right. And that is just the entire thing that sometimes is very confusing to a nursing student. So now that we have that background, let's try to get into the lecture again with a proper perspective. And so neonatal jaundice, like I said, is also known as hyperbilirubemia. It's a disorder that causes the infant skin to appear yellow in the first few days of life. And so when we have this neonatal jaundice, because that bilirubin is floating around in the bloodstream, the baby is going to have some yellow discoloration. And we're going to see that jaundice is a physical assessment that you see. You're going to see that in the yellowing of the eyes and the skin. Okay. Also, you can see the dark yellow urine as well. All right. So they may have dark yellow urine, and then the stool is going to be a pale color. The stool is going to be a pale color when a baby has jaundice. So we really want to monitor the jaundice because it is a symptom of something else happening. If a patient or a baby has jaundice, then we know that there's some sort of pathological process going on. So if the jaundice gets worse, if it becomes noticeable below the knees, if the jaundice appears darker, so first it's like a lemon yellow, and then NCLEX can say the baby has an orange tint to it, then that's it getting worse. If the newborn is having a fever, if the newborn is having trouble eating as well, these are just worsening deterioration symptoms. And, we understand that as our patient has this bilirubin that is floating around, that it is possible for brain damage to occur. And so if the baby is sleeping more than normal, they're difficult to awake, if they're agitated, can't get calm, and if they start to have some backwards arching of the neck and posture changes in their body, then we know that the brain is very much getting inflamed. The brain is suffering because this bilirubin, this fat soluble bilirubin, is settling now. Okay. So what are we going to do for this? Our nursing assessment findings are going to be to, number one, determine why this jaundice is happening. We're going to look at the severity of it. So we have the baby in a well-lit room. We blanch the skin, digital pressure, and we release it. And we're looking to see any skin color changes in the subcutaneous tissue. We also should understand the difference between the unconjugated or indirect bilirubin versus the wait, hold on. We need to understand the unconjugated or indirect bilirubin versus the direct or conjugated bilirubin. All right. Let me know if you guys want me to explain that again, because we do have different priorities based off of what type of bilirubin we are dealing with. Okay. So these are the little nuances that make us safe nurses when we can have these types of conversations. So are we good on unconjugated or indirect bilirubin? Let me know. Let me know. All right. Conjugated or direct bilirubin. So this is another common condition after, okay, somebody's like, no, explain it again. Okay, hold on one second. So unconjugated or indirect bilirubin. Remember, this is the fat soluble bilirubin. This is the fat soluble bilirubin that if it is in the bloodstream, the thing the NCLEX wants you to think about, the organ the NCLEX wants you to think about is the what? It is the brain. It's the brain, okay? Because too much of the unconjugated or indirect will affect the brain. The direct or conjugated bilirubin has already been to where? It's already been to the liver. So if a baby has too much conjugated bilirubin, then we know that they're having liver issues. We know that they're having liver problems. So one is for the brain, one is for the liver. Okay, let me go back to the slide again. Unconjugated or indirect, we worry about the brain. Conjugated or direct, we worry about the liver. Okay, I think that's the biggest point. All right, Coombs test. This is a test that is used for a sample of the newborn's blood, and this can be done in the case of a baby who has jaundice. The treatment for neonatal jaundice, we're going to do, and of course it depends on, of course, the cause, but phototherapy is the main treatment for babies with unconjugated bilirubin. We're placing the infant under a special blue-green light. You can do some immunoglobulin therapy, IV. It is a protein that can lower the antibody levels. It may alleviate jaundice and reduce the need for an exchange transfusion. Exchange transfusions. Look these up, guys. And this essentially, these remove the infant's blood with excess bilirubin levels. Sometimes there's antibodies that are red blood cells that are coated with them, and the baby's blood is essentially replaced with new donor blood. Our nursing interventions for a baby, specifically when it comes to phototherapy, we're applying patches to closed eyes. We're also checking the eyes every 2 hours when the patches are removed for feedings, and we are going to regularly check the placement. Using sterile or regular saline water to watch the baby's eyes, they can be very damaged with this. We really want to make sure that we're paying attention to the soft organs of the eyes with phototherapy. We're changing the position every 2 hours. And then we expect the baby to have more stools, better stools to help alleviate this bilirubin levels in their bodies. So after they, have stool, and we wash the perianal area, and we check it for any problems of rash or skin breakdown. All right. Again, when we are studying, I'm always coming from something from Quick Facts or the V2 student workbook. So where you're putting this information. It's not enough to just know it, but you have to be able to apply it and see the big picture of nursing. And that's really the challenge for a lot of nursing students. You know a lot of different facts, but you don't have a understanding of how it all works together. So when you do the V2 at the end of it, you have a better understanding of how it works together. So shout out to you guys that are in the program, you're doing the study calendar, and then you're coming here on top of that to get a further understanding of the things that you're reading. So very proud of you today on this Monday if you're in that process. Okay, again, just for those of you who missed it, I was talking about the nursing school curriculum program that will be coming. And already we have the Amazon delivery, one-day delivery for Quick Facts for Nursing School. For those of you who like to get it fast, it's on Amazon Prime now. So super excited about that. Now, let's dive into our NCLEX questions. I do have a couple NCLEX questions because that is how you know if I have understood what Professor Regina has said, or do I need to go back and watch it again, look it up again. Okay, question number 1, here we go. Let's go. We are talking about hyperbilirubemia, neonatal jaundice. Question number 1 says, the nurse monitors a 2-day-old newborn with yellow discoloration of the skin and sclera due to maternal and child Rh incompatibility. What condition occurs when antibodies in a pregnant woman's blood attack fetal cells? Number 1, sickle cell anemia. 2, rhesus disease. 3, respiratory distress syndrome. Or 4, acute bilirubin encephalopathy. Come on and put the answers in the comments. This is how we get down on Monday. All right. And the question here is, what condition can occur when you have the mother's antibodies attacking that baby? We call that number 2, rhesus disease. And this happens in the case of pregnant woman's blood carries antibodies that destroy the blood cells of her unborn child. And so check it out, write it down if you weren't familiar with it or you weren't able to get this one right by an educated guess. Because on NCLEX, you're not going to know every single thing, but you do have to be able to apply what you learned, what you heard, and make an educated guess. Okay. All right. And first, let me just run it back. For those of you who put acute bilirubin encephalopathy, we did talk about this today in class. However, if and when we talked about it, it had nothing to do with the pregnant woman's antibodies. We talked about this in regards to what? Unconjugated bilirubin. So make sure that you are looking for the answer in the question. Okay. All right. Yep. Question number 2 says this: the nurse monitors an infant on phototherapy secondary to neonatal jaundice. Which of the following is an appropriate nursing action regarding phototherapy? Number 1, clean the eyes with tap water. Number 2, reposition every 2 hours. Number 3, put a blanket on the infant's legs. Number 4, put the baby 10 inches from the lamp. You guys say? I just saw one of the topics that I wanted to talk about here in this question, so I underlined it in Quick Facts. All right, I see a lot of answers on the screen, and they are mostly the right one. The right correct answer for this is number 2, repositioning the infant every 2 hours. This is the one. Now, in Quick Facts, it actually talks about number 4. Number 4 I have here, put the baby 10 inches from the lamp. This is very important to know the distance between the lamp and that baby. So if you saw it or you read it in Quick Facts and you know it, go ahead and put the answer on the screen. How many inches should the baby be away from the lamp? All right. Content. Question number 3 is this: A newborn is diagnosed with neonatal jaundice on the second day of life. Which of the following nursing interventions is the priority to prevent complications? Number one, encourage frequent breastfeeding every 2 to 3 hours. Number two, administer vitamin K to prevent bleeding. 3, monitor the infant's weight daily. Or 4, prepare the infant for phototherapy. What do you say? Come on in live from the V2 on this Monday. We have class every noon Eastern time, no matter what. No matter what, every Monday, whether it's holidays, whether it's sick days, whether we're on vacation, we have this class. It's very important for us to come together and look at these specific content areas. Okay, I see some ones, I see some fours. Ooh, I see some ones and fours, really. The correct answer here is number 1, because when we are talking about the bilirubin, how does it leave the body? How does it leave the body? It leaves the body through stool. So we want that baby to be drinking breast milk, drinking formula. This is a very common question that shows up on NCLEX because it wants to see if you know the connection between bilirubin and the organs. Okay? Because remember, bilirubin is a byproduct of the breakdown of red blood cells. It is not supposed to be circulating in the system, right? So you have to understand how it leaves the system, and being able to point out feedings, frequent feedings, demonstrates you have that competency. Okay. So, how well did you do? Are you happy with your progress today? Are you managing the content in a way that's appropriate? Or are you not being consistent? Are you just doing practice questions, just watching me on YouTube every now and then when you feel like it? Because if you are not finding yourself where you need to be, then you have to make some new decisions to get there. Okay. And when it comes to this test, when it comes to preparing for this test, the decisions that you make have to be rooted in progress. They have to show that you're making some good progress. Okay. Because the closer you get to your test date, the more comfortable you will feel if you are doing the work, So my goal for you today was for you to show up and have a better understanding between conjugated bilirubin and unconjugated bilirubin. And so if that was done, then I've done my job. But that is a very small part of the bigger picture. That's a very small part of the bigger picture. So right now, go to readmarnurse.com and get the V2 workbook and get the V2 videos and get quick facts if you do not have them. All right. Also, don't forget that when I say the training that takes place, the training that you should be doing should be didactic, meaning you're hearing lectures, you're listening to them. Okay. If you're not listening to the lectures because you're bored or they're too long or they're distracting, then you need to find some place for you that you can learn. Also, I do have questions in the V2, and I do have CAT exams. The CAT exams in the V2 are to help discipline you to sit for 5 hours to take this test. Okay. And then one thing that I love about the V2, I think that is extremely special and unique, is the workbooks that come with them. You learn and retain something so much longer when you write it down. And so if you're not incorporating that part of the process, expect it to take a little bit longer to get through it. Okay. And then, of course, the daily study schedule that will have you being able to block out periods of time in order to focus and set yourself on the right path. When it comes to getting the V2, I would say the most important thing to remember and pick out is how long you need to be in it. The V2 is a system that is subscription based. So you can get 1 month's access, you can get 3 months, or you can get 6 months. Most of you will need the 3 months. It will take, I would say, that length of time in order for you to go through the program, go through quick facts, and then be able to redo it again. Even if that means, okay, even if that means you just listening to them the second time around, not writing anything down, but just listening to them. It is helpful, and it is going to give you that feeling like, okay, NCLEX is not as hard as people said it was. Okay. It's not as hard as people said it was. People who say that have been well training. Okay. And so if you need to get into my program, please visit my website. And it's really easy, remarnurse.com. remarnurse.com. And you'll choose whether you're an RN or PN. Okay. RN or PN. We have programs for both. I'm really excited because I'll be visiting some schools next week to show them how to use V2 for their students, show them how we can keep students in nursing school longer, because there is a problem with students getting into nursing school, but then failing out at pharmacology. You guys know, failing out at pharmacology or failing out at critical thinking or critical care. And so the V2 and the things that I have in there are extremely beneficial to those of you who need to achieve a certain proficiency level, or your school is going real fast. Like, please understand, I have something to keep you in nursing school. Okay. Do you have the calendar? Yes, you can. The calendar is there as a guide. With the calendar, I have you studying 5 days, 5 days a week. You don't have to study 5 days a week. Just focus more on the study sessions. Okay. The study sessions tell you how much you should be doing in one sitting. So that's what I would say for that. All right. Again, for those of you who are in nursing school, you're invited to my Back to School Nursing 101 event. It is free. It is free. You can sign up for it. The way to sign up for it is right at the top there, remarnurse.com, back to school. And this will be all about, let me see if I have the date here on the next one. Yeah, Monday, August 26th. And it's going to happen in the evening at 8 p.m. Eastern Standard Time. And this will be all about how to position yourself for nursing school to be successful. I'm going to do a mini review, which is fundamentals. I'm going to do fundamentals and pharmacology, and then also how to get better scores on those proficiency exams, whether you're taking ATI, whether you're taking HESI, those markers, those bench markers. Okay. What website can I use? remarnurse.com, remarnurse.com. So as we get into the second part of our Monday classes, these are to me the most important because they help us to think about the rest of the week. And the motivation for this week, Monday motivation, the Lord is my helper. The Lord is my helper. And I like this picture right here because obviously this man is struggling up this specific mountain. I don't know what mountain it is. I don't know what the mountain is called or where it is located, but I certainly have the experience of the struggling to get to a certain place or do something. And you see that there is a person already up at the top, and they're helping to pull the man up. I like that because you can see he's literally being pulled up because his feet are not touching the mountain anymore. Gosh, I need that kind of help this week. Like, I need that kind of help this week, Lord. Just pull me up the thing. I can't even climb it anymore. Just pull me up to the thing. And so if that is what you're wanting and you're trusting God to do to get you over the mountain, I want you to think about where right now you're currently putting your confidence in. Is it in your strength? Is it in your money? Is it in your job, your ability? Like, are you putting your strength there? I hope not. I hope not this week, because whatever plans you have made, if you have not run them through God first, if you have not put them through the filter of the Holy Spirit, then you can expect them not to turn out the way you planned, because that's just what life is. Life always has a curveball. You ready for a straight shot? Here comes the curveball in life. And so oftentimes we find ourselves putting our plans, our goals, our dreams in the confidence of temporary things, because to be honest, it's what everybody else is doing. and it seems faster. It seems faster to just get up in the morning and start your day and just say, okay, I got to get X, Y, and Z done. Like, I better hurry up. I got to get the kids out the house. I got to, like, it's easy to do that. But then when those things don't work out, or we find ourselves with a huge setback, whether it's a disease or it's physical or it's loss or it's suffering, everything crumbles. Okay. And we're like, man, how did this happen? How did this happen? Well, here's our verse, Hebrews 13:6-8. And it says this. So we say with confidence, the Lord is my helper. I will not be afraid. What can mere mortals do to me? Remember your leaders who spoke the word of God to you. Consider the outcome of their way of life and imitate their faith. Jesus Christ is the same yesterday and today and forever. I love that. God is the same yesterday and today and forever. So our takeaways are, your confidence should be in the eternal truth that no matter what happens in life, the Lord is your helper. Jesus uses people to encourage our faith. Okay. And we may face difficult challenges in life, but we all have the same God who can help us. So be encouraged, and be encouraged by the testimony of others. Of course, we believe in that here for sure. But there are some things that I didn't have the power to do that God is giving me the strength to do. Right. And there may be some things that you didn't think that you would be able to do even last week that you have come to Monday and said, wow, I really got it done. I really was able to do that thing. So let us give our plans to God this week and say, Lord, these are the things I would like to do. It's really just simple. Lord, these are the things I would like to do today. Not even this whole week. Let's just get through today. Some of y'all said, Lord, just pull me through today. Okay. I'll handle tomorrow. Sufficient are the worries of today. Lord, there's some things I would like to get done today, but I need you to do it for me. I need you to pull me up that mountain so that I can get it done. All right. And this is a truth. And this is what it's like, I think, to have a relationship with God, where we don't just come to him and give him a wish list like he's Santa Claus. Like, here, God, I want the house. I want the NCLEX. I want, no, it's just like every day, I'm just trying to remind y'all that relationships are daily conversations. That's how they start. When you're dating somebody, you have a conversation with them all day, right? Just throughout the day. It's like that with God too. Like, Lord, I'm about to eat this lunch. I don't know if it's gonna mess me up, or I don't know, but I just need you to give me the nutrition to get to the next thing. All right. Let's have a great relationship with God today. And let's just say, hey, it's Monday motivation, Lord. Pull me up that mountain. That picture, Lord, that was you and me. That was you and me for today. God is good. We can find him. Absolutely. We can find him in the simple things in our everyday walk. But I'm so grateful for today. I'm so grateful to be here with you and for us to have this opportunity to put our minds and our hands toward the ministry of nursing. It's a beautiful purpose in this life. And it is very fulfilling when you have a passion to serve others. And you will see that as you are serving other people, strangers will begin to bless you. Strangers will begin to give you favor uncommonly. So that's just our portion in life. So thank you guys so much. I say this all the time, but I really mean it. You can, you will, and you must pass NCLEX. See you later.